Everyone for joining us today. We're going to get started here. We're joined today by Health Minister Jean-Yves Duclos, as well as Chief Public Health Officer Dr. Theresa Tam, and Deputy Chief Public Health Officer Dr. Howard New. We have a limited time for questions today, so I'll hand it right over to the Minister to get us started. Minister?
Bonjour tout le monde et merci d'être avec nous aujourd'hui. Good morning everyone and thank you for being here today. Dr. Tam and Dr. New are joining virtually and will deliver an update on the current epidemiological situation. Dr. Tam et Dr. New se joignent à nous virtuellement et procéderont bientôt à une mise à jour de la situation épidémiologique. I will then proceed with an update of my own. Dr. Tam, over to you.
Merci, Minister Duclos. Bonjour à toutes et à tous.
Thank you, Minister Duclos.
Last
Hello,
week,
everyone.
our modeling update cautioned us of the potential for a strong resurgence in the coming weeks. The model looked at the current level of transmission with continued predominance of the Delta variant in Canada, as well as with spread and potential replacement by the Omicron variant. In the coming weeks, the longer range forecast shows that if Omicron replaces Delta, as we've seen elsewhere, we could have a much stronger and faster resurgence than we've seen before. This could affect jurisdictions across Canada with the potential to overwhelm healthcare capacity. Since last week, Omicron numbers have increased rapidly around the world. On Tuesday, the World Health Organization remarked that Omicron has been reported in 77 countries worldwide, but is probably already in most countries, even if not detected yet. In Canada, close to 350 confirmed cases have been reported in 11 provinces and territories. Increasing numbers of these cases are not linked to travel, signaling that community transmission has been established in several areas of the country, with outbreaks occurring in multiple settings. Omicron cases have been reported in both vaccinated and unvaccinated people, as well as in previously infected people. However, it is important to stress that being fully vaccinated and then getting a booster, whether Pfizer or Moderna, is expected to provide a reasonable level of protection against infection and likely strong protection against severe illness. However, in order to counteract what is the most rapidly spreading variant to date, it is also clear that we must combine protection from vaccines with continued best efforts in layering public health measures and individual precautions. While we are still studying the severity profile of this variant, if Omicron replaces Delta, it's expected the sheer number of cases could inundate the health system in a very short period of time. Currently, the rapid increase in Omicron cases is likely already contributing to the accelerated growth we're seeing in several jurisdictions. Over the past 7 days, an average of over 5,000 new cases were reported daily across Canada, which is 45% higher than the previous 7-day period. Severe illness trends have begun to increase in the most heavily impacted provinces, which may be more associated with rising levels of Delta variant activity over the preceding weeks. Over the past week, on average, 1,450 people with COVID-19 were being treated in our hospitals each day, with over 450 in intensive care units and 19 deaths were reported daily. These latest trends in disease activity increase the urgency to slow the rate of spread immediately in an effort to head off as much of the acceleration as we can. We need to keep doing what we know has worked, but do it with greater speed, vigilance, and perseverance, incorporating all of the improvements we've gained over the past 2 years. This means getting everyone who is now eligible to be fully vaccinated as soon as possible to protect against severe outcomes. That amounts to over 7 million eligible Canadians who need a first or second dose of their primary series. In addition, we need all who are eligible to get a booster dose to help restore protection that may have waned since the second dose. The National Advisory Committee on Immunization continue to recommend that as programs roll out, Booster doses should be prioritized for the previously listed priority populations. NACI also emphasizes the importance of booster doses for all healthcare workers and for those at the highest risk of severe illness from COVID-19, including older adults and people with high-risk medical conditions. As we've said time and again, our COVID-19 response requires a vaccine plus approach. No vaccine is perfect, and the possibility of reduced protection against Omicron further emphasizes the need for multiple layers of protection. These layers are better than ever thanks to the greater understanding of the settings and activities that can lead to large spreading events and improved knowledge of the way the virus can linger in fine aerosols. So now more than ever, we all need to bring our best layers of protection to bear. That includes the following updated guidance on indoor ventilation and recommendations on proper use, construction, and fit of face masks. As health authorities across Canada strengthen recommendations to protect our already strained and fragile healthcare system, and as profoundly exhausted healthcare workforce is faced with a potential looming crisis in the weeks to come, I am urging Canadians across the country to please carefully consider and adjust your holiday plans to minimize risks and maximize layers and quality of protection for you and yours. As well, given the significant risks and uncertainties associated with rapidly expanding spread of the Omicron variant worldwide, Canadians are advised to avoid all non-essential travel outside of Canada at this time. If you must travel, be aware of current and rapidly evolving requirements for visiting other countries and for returning to Canada. I know we are all weary, but as all storms run out of wind and rain, so too will this one. For now, we must all hold on tight to our protections for ourselves and each other a while longer. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. La mise à jour de la modélisation présentée la semaine dernière laissait entrevoir la possibilité d'une forte résurgence dans les semaines à venir. Le modèle tenait compte du niveau actuel de transmission, caractérisé par la prédominance continue du variant Delta au Canada, ainsi qu'avec la propagation et le remplacement potentiel par le variant Omicron. Selon les prévisions à plus long terme, si le variant Omicron remplace le variant Delta, comme nous l'avons vu ailleurs, la résurgence pourrait être beaucoup plus forte et rapide que ce que nous avons connu à ce jour. Cette situation pourrait avoir des répercussions sur les provinces et territoires de tout le Canada et pourrait entraîner une surcharge des services de santé. Depuis la semaine dernière, le nombre de cas liés au variant Omicron a augmenté rapidement dans le monde. Mardi, l'Organisation mondiale de la santé a fait remarquer que le variant Omicron a été signalé dans 77 pays, mais qu'il est probablement déjà présent dans la plupart des pays, même s'il n'a pas encore été détecté. Au Canada, près de 350 cas confirmés ont été rapportés dans 11 provinces et territoires. Le nombre de cas qui ne sont pas liés à des voyages est en augmentation, ce qui indique que la transmission communautaire s'est établie dans plusieurs régions du pays. D'ailleurs, les éclosions se produisent dans différents milieux. Les cas liés à Omicron ont été signalés tant chez des personnes vaccinées que non vaccinées, ainsi que chez des personnes qui ont été infectées précédemment. Toutefois, il est important de souligner que le fait d'être entièrement vacciné et de recevoir ensuite une dose de rappel, qu'il s'agisse du vaccin Pfizer ou Moderna, devrait offrir une protection raisonnable contre l'infection et probablement une forte protection contre les formes graves de la maladie. Cependant, si nous voulons contrer ce variant dont la propagation est la plus rapide à ce jour, il est évident que nous devons combiner la protection offerte par les vaccins avec le maintien des mesures de santé publique et des précautions individuelles. Nous étudions encore le profil de sévérité du variant Omicron. Toutefois, si le variant Omicron remplace le variant
Omicron
Delta,
replaces
le
Delta,
nombre de cas
it's
pourrait
expected
engorger
the
le
sheer
système de
number of
santé
cases
en
could
très peu de
inundate
temps.
the health system
À
in a
l'heure
very short
actuelle,
period of time.
l'augmentation rapide des cas
Currently, the
attribuables
rapid
au variant
increase
Omicron
in Omicron
contribue
cases is
probablement
likely
déjà
already
à la
contributing
croissance
to the accelerated
accélérée
growth
que
we're
nous
seeing in
observons
several
dans plusieurs
jurisdictions.
régions. Au cours des 7 derniers
Over
jours,
the past
plus de
7
5 000
days,
nouveaux cas
an
ont été
average of over
signalés en
5,000
moyenne
new
chaque jour
cases
au
were
Canada,
reported daily
ce qui
across Canada,
représente une
which is
augmentation de
45%
45
higher
par
than the
rapport à
previous
la période
7-day
de 7
period.
jours précédente. Les tendances relatives aux cas graves ont
Severe illness
commencé à
trends have
augmenter dans les
begun to
provinces les
increase
plus
in the most
touchées,
heavily
ce qui
impacted
pourrait être
provinces,
principalement
which may be more
associé à
associated with rising
l'augmentation des
levels
niveaux
of Delta
d'activité
variant
du variant
activity
Delta
over
au
the
cours des
preceding
semaines
weeks.
précédentes. Au cours de la semaine
Over
dernière,
the past
en moyenne,
week, on average,
1,450 personnes
1,450
atteintes de la
people
COVID-19
with
ont été traitées
COVID-19 are
chaque jour
being treated
dans nos
in our
hôpitaux,
hospitals
dont
each
plus de
day, with
450
over
dans les unités de
450
soins
in intensive
intensifs
care
et
units,
19 décès
and
ont été
19
signalés
deaths were
chaque jour.
reported daily.
Ces dernières tendances en
These
matière
latest trends in
d'activité
disease
de la
activity
maladie mettent
increase
en
the
évidence
urgency to
l'urgence
slow
de
the rate of
ralentir
spread immediately
immédiatement
in
le
an
rythme de
effort
la
to head off
propagation
as much
afin
of the
de freiner
acceleration
autant que
as we
possible
can.
l'accélération de la maladie. Nous
We
devons
need to
continuer
keep
à
doing
appliquer les
what we
mesures
know has
éprouvées,
worked,
mais avec plus de
but do
rapidité,
it
de
with greater
vigilance
speed,
et de
vigilance, and
persévérance en tenant
perseverance,
compte de tous les
incorporating
progrès que
all
nous
the
avons
improvements
accomplis
we've
au
gained
cours des 2
over the
dernières
past 2
années.
years.
Cela signifie que toutes
That
les
means
personnes
getting
admissibles
everyone who is
doivent
now
être
eligible
entièrement
to be
vaccinées
fully
dès que
vaccinated as
possible
soon as
pour se
possible
protéger
to
contre les
protect against
complications
severe
graves.
outcomes.
Cela
That
représente plus de
amounts
7
to over
millions de
7 million
Canadiens
eligible
admissibles
Canadians
qui ont besoin
who need
d'une
a
première
first or
ou
second
d'une
dose
deuxième dose de
of
la
their
série
primary
primaire.
series.
De plus,
In
il faut que
addition,
toutes les
we
personnes
need all who
admissibles
are eligible
reçoivent
to
une
get
dose de
a booster
rappel
dose
pour rehausser la
to help
protection
restore
qui a pu
protection
s'affaiblir
that may have
depuis la deuxième dose.
waned since the
Le
second
Comité
dose.
consultatif national de
The
l'immunisation,
National
ou
Advisory Committee
CCNI,
on
continue de
Immunization
recommander
continues to
l'administration de
recommend
doses de
that as
rappel aux
programs roll out,
populations
booster
prioritaires
doses should be
énumérées
prioritized for
précédemment à
previously
mesure que
listed
les
priority
programmes
populations.
progressent. Le CCNI souligne également
NACI also
l'importance des doses de
emphasizes the
rappel
importance of
pour
booster
tous les
doses
travailleurs de
for
la
all
santé
healthcare
et pour
workers
les personnes
and
les
for
plus
those at
susceptibles
highest
d'être
risk of
gravement
severe
malades
illness
si elles
from
contractent la
COVID-19,
COVID-19, notamment
including
les
older
personnes
adults
âgées et
and
les
people
personnes
with high-risk
présentant
medical
des
conditions.
affections à haut risque. Comme nous l'avons
As
dit
we've
et
said
répété,
time
nous
and
devons
again,
adopter une
our
stratégie
COVID-19
de
response
vaccination
requires a
accrue
vaccines plus
dans
approach.
notre réponse à la pandémie de COVID-19. Aucun vaccin
No
n'est
vaccine is
parfait
perfect,
et comme il
and
est
the
possible que les
possibility
vaccins
of
contre
reduced
le variant
protection against
Omicron
Omicron
offrent une
further
protection moindre,
emphasizes the
il
need
est important,
for
il
multiple
est
layers
encore
of
plus
protection.
important d'employer de multiples couches de protection. Ces couches
Those
sont plus
layers are
efficaces
better
que
than
jamais
ever
grâce à une
thanks
meilleure
to a greater
compréhension
understanding
des
of the
milieux
settings
et
and
des
activities
activités qui
that
peuvent
can
donner
lead
lieu
to
à de
large
grands
spreading
rassemblements
events
favorisant la propagation
and
et une meilleure
improved
connaissance de la
knowledge of the
façon
way
dont le
the virus
virus
can
peut
linger and
persister
find
dans des fines
aerosols.
aérosols. Alors, nous avons besoin de nos meilleures couches de protection.
So
Cela
we need our
consiste
best
notamment
layers of
à
protection.
suivre les guides de
That
ventilation
includes
des
following
espaces
updated
intérieurs
guidance
mis à
on
jour
indoor
et les
ventilation and
recommandations sur la bonne
recommendations on proper
utilisation,
use,
la fabrication,
construction,
le
and
bon
fit of
ajustement
face
des masques.
masks.
Alors que les autorités sanitaires de tout le
As
Canada
health authorities
renforcent
across
leurs
Canada strengthen
recommandations pour
recommendations
protéger
to
notre
protect
système de soins
our
de
already
santé,
strained and
déjà mis à
fragile
rude
healthcare
épreuve et
system,
fragile, et que le personnel de santé déjà
and as a
épuisé
profoundly
sera
exhausted healthcare
probablement
workforce is faced with a
confronté à
potential
une
looming
crise dans les
crisis
semaines à
in the
venir,
weeks to
je
come,
prie les
I
Canadiens
am
de tout
urging
le pays
Canadians
de
across the
recevoir
country
et
to
d'adapter
please
leurs
carefully
projets de
consider
vacances
and adjust
afin de
your
minimiser
holiday
les
plans
risques et de
to minimize
maximiser les
risks
niveaux
and
et la qualité
maximize
de
layers and
protection
quality of
pour eux-mêmes
protections
et pour leurs
for you
proches.
and yours.
De plus,
As
compte tenu
well,
des risques et
given
des
these significant
incertitudes
risks and
considérables
uncertainties
associés à
associated
la
with the
propagation
rapidly
rapide du
expanding
variant
spread of the
Omicron dans
Omicron
le monde
variant
entier,
worldwide,
il est conseillé aux
Canadians
Canadiens
are advised
d'éviter
to
tout
avoid
voyage non
all non-essential
essentiel
travel
à
outside of
l'extérieur
Canada
du
at this
Canada
time.
pour le moment. Si vous
If you
devez
must travel,
voyager, soyez
be aware
conscient
of
des
current and
exigences
rapidly
actuelles
evolving
et
requirements
changeantes
for visiting
liées
other
au voyage à
countries
l'étranger
and
et au
for
retour
returning
au
to
Canada.
Canada.
Je sais que tout le
I
monde
know
est
we are
tanné,
all
mais
weary,
comme n'importe
but as
quelle
all
tempête,
storms run
celle-ci
out of
finira
wind
par
and rain,
s'épuiser.
so too two
Pour
or this
l'instant,
one.
nous devons
For
tous
now,
nous
we must
agripper
all
à
hold
nos
on tight to
à nos
our
protections
protections
pour nous-mêmes
for
et pour
ourselves
les
and each
autres
other
pendant
a
encore
while
un
longer.
moment. Merci. Thank you. Miigwech.
Merci, Dr. Tam and Dr. New. As the doctors just mentioned, we are still learning about Omicron and the extent to which it may impact transmissibility, severity of disease, and the effectiveness of vaccines and treatments. As mentioned on Wednesday, our approach is guided by one core principle: prudence. We are all very aware that any increase in hospitalizations at this time would put our already fragile healthcare system and our healthcare workers under further strain. We need to stay alert and ready to act on changing trends and new information. Today, I have two main announcements to make in regards to federal response. First, with the evolving situation and overwhelming evidence of community transmission of Omicron in most countries around the world, we have taken the decision to lift the specific measures for travelers returning from the 10 countries initially listed. This will be in effect as of December, Saturday, early in the day. While we recognize that this initial emergency measure created controversy, we believe it was a necessary measure to slow the arrival of Omicron in Canada at a time of uncertainty and unknowns. Given the current situation, this measure has served its purpose and is no longer necessary. As I said, this measure will be in effect as of December 18th, 11:59 p.m. Second, we are reintroducing the requirement for a pre-arrival PCR test result for all travelers leaving the country for less than 72 hours. As of December 21st, the requirement for pre-arrival testing will therefore be in place again for all trips of all durations. It is important to note that this pre-arrival test will need to be taken in a country other than Canada. As I announced Wednesday, the Government of Canada is advising Canadians to avoid all non-essential travel outside the country. Official notice of this travel advisory is posted on travel.gc.ca. I will say it again, now is not the time to travel. We know how difficult it is for Canadians to have to postpone their travel to visit families or friends or to take a break abroad. We are also aware of the many Canadians who are listening and are canceling their trips. These Canadians are leading by example and helping protect the health of their family, their community, and of themselves. We do not want you to be stranded or to be sick abroad. Once you have left the country, once you are stranded, once you are sick, there is little the Canadian government can do to help you. In regards to testing at our borders, since our initial announcement at the beginning of the month, we have significantly increased the on-arrival testing. We have gone from a capacity to test 11,000 air travelers a day on November 30th to a capacity of 17,000 last Friday to a capacity of 21,000 today, out of a goal of 23,000. Officials are working closely with airport authorities, airlines and testing providers and many other partners to increase capacity at airports, manage traveler flow, and to make sure that the best testing protocol are implemented and as efficiently as possible. Furthermore, on Wednesday night, I met with all of my provincial and territorial colleagues, and we all agreed to continue to work together to address the current situation in a coordinated and collaborative manner. My provincial and territorial counterparts and I have all agreed to do our part in order to slow down the spread of Omicron, which means A, speeding up the administration of boosters to Canadians, B, enhancing public health measures, and C, making rapid tests more broadly accessible to the general public. To my fellow health ministers across the country, I want to say very clearly, you can continue to count on the federal government to support you. We are all there to help each other. Our supply of vaccine is ready and available to provinces and territories, and we are encouraged by the provinces and territories reaffirmed strong commitment to speed up their booster programs. Provinces and territories have requested 35 million rapid tests for December, and we will meet that demand of 35 million rapid tests, most of which have already been delivered. Thanks to the significant investments confirmed by my colleague, Minister Freeland, the Deputy Prime Minister, over the coming months, we will procure and supply hundreds of millions of additional rapid tests to our colleagues in provinces and territories. We are also making all necessary preparations in order to be ready if and when our provincial and territorial partners should require additional support. Provinces and territories know and must know that when they will turn to us, we will always be providing a helping hand. Our common goal is to protect the health and safety of all Canadians wherever they may be. Once again, let me be very clear. Our collective and individual actions over the coming weeks will determine our faith over the coming months. This is true for governments. It's also true for all of us citizens. To my fellow Canadians, I want to deliver a very simple message. We must all do our part. We know you have made a lot of sacrifices. I know that we are all sick of this pandemic. I know that this is psychologically and mentally difficult, but we Canucks have been through that. We've come this far. Now is not the time to give up. And we can do this. If you haven't gotten your first or second dose, go now. If you're eligible for your third dose, go now. And please avoid all travel and follow all provincial and local health guidelines. Together, we and that can save lives. Je vais maintenant me tourner vers mes concitoyens francophones. Comme l'ont mentionné les docteurs, nous en apprenons chaque jour davantage sur le variant Omicron, ainsi que les effets que ce variant peut avoir sur la transmissibilité, la gravité de la maladie et l'efficacité des vaccins et des traitements. Comme il en a été question mercredi, notre approche est fondée sur le principe principal, celui de la prudence. Nous sommes tous pleinement conscients du fait qu'en ce moment, toute augmentation du nombre d'hospitalisations mettrait encore davantage à l'épreuve notre système de santé et les travailleurs de la santé déjà fragilisés. Nous devons rester vigilants et nous tenir prêts à agir en fonction de l'évolution des tendances et des nouvelles informations à venir. Aujourd'hui, j'ai deux annonces à faire en ce qui concerne la réponse du gouvernement canadien à cette crise. Premièrement, compte tenu de l'évolution de la situation et du fait que le variant Omicron se transmet dans la communauté à travers tous les pays, nous avons pris la décision de lever les mesures exceptionnelles pour voyageurs revenant des 10 pays initialement visés. Cette décision prendra effet à 23h59 le 18 décembre. Nous sommes conscients que cette mesure initiale a soulevé une certaine controverse, mais nous estimons qu'elle était nécessaire pour ralentir l'arrivée du variant Omicron au pays et nous faire gagner du temps précieux. Compte tenu de la situation actuelle, cette mesure a joué son rôle et n'est plus nécessaire. Deuxièmement, nous rétablirons l'exigence de présenter avant le retour un résultat négatif au test PCR pour tous les voyageurs qui quittent le pays pour moins de 72 heures. À partir du 21 décembre, l'obligation d'effectuer un test de dépistage avant le retour sera donc de nouveau en vigueur pour tous les voyages, même les courts voyages, et ce, peu importe leur origine ou à nouveau leur durée. Il est important aussi de souligner que ce test avant le retour devra être effectué dans un autre pays que le Canada. Comme je l'ai annoncé mercredi, le gouvernement du Canada conseille fortement aux Canadiens d'éviter tout voyage non essentiel à l'extérieur du pays. La version officielle de cet avis aux voyageurs est affichée sur le site voyage.gc.ca. Je le répète,
I
Ce
will
n'est
say
pas
it
le
again.
moment maintenant
Now
de
is not
voyager.
the time to travel.
Nous savons que de nombreux Canadiens
We are
suivent ces
aware
recommandations et annulent ou
Of many
retardent leur
Canadians who are
voyage.
listening and are
Ces
canceling their
Canadiens
trips.
montrent
These
l'exemple
Canadians
et
are leading
contribuent
by
à
example
protéger
and helping
la
to
santé
protect
de
the
leur
health of
famille,
their
de
family,
leur communauté
their community,
et
and
d'eux-mêmes.
themselves.
En effet, une fois que les gens se retrouvent coincés
When
ou
people
malades à
are
l'étranger,
sick or
il y a
stranded
très peu que
abroad,
le gouvernement
there is
canadien
very
peut
little
faire pour leur
that the
venir
Canadian
en aide.
government can do to assist them.
En ce qui concerne les tests effectués aux frontières, depuis
Regarding
notre annonce
tests
initiale au
at
début
the
du mois,
border,
nous avons considérablement
Since our initial
augmenté le nombre
announcement
de
at the
tests
beginning of
de
the month, we have
dépistage à l'arrivée.
significantly increased
Nous
the
sommes passés
on-arrival
d'une
testing.
capacité de dépistage de
We have
11
gone
000
from the capacity to
voyageurs
test
aériens
11,000
le
air
30
travelers
novembre
a day on
dernier
November 30th
à 17 000
to
tests par jour
17,000 tests
vendredi
per day
dernier
last
et nous en
Friday
sommes maintenant à 21 000 par rapport à un
21,000
objectif de 23 000 en tout.
now, and our goal is
Les
23,000.
fonctionnaires travaillent en étroite collaboration
Officials are
avec les
working closely
autorités
with airport
aéroportuaires, les
authorities,
compagnies
airlines, and
aériennes,
testing
les fournisseurs de
providers,
tests et de
and many
nombreux
other
autres
partners
partenaires
to increase
afin d'accroître la
capacity at
capacité dans
airports,
les aéroports de gérer correctement
manage
la
traveler
circulation des
flow,
voyageurs
and
et de
to make
veiller à
sure
ce que le
that the testing
protocole de
protocol
test
is
soit
as
aussi
efficient as
efficace
possible.
que possible. Par ailleurs, mercredi soir, j'ai rencontré
Furthermore,
tous mes
on Wednesday
homologues
night,
provinciaux
I met
et
with all of my
territoriaux et nous
provincial
avons
and
convenu
territorial
de continuer à
counterparts, and we
travailler
all agreed to
ensemble
continue
pour
working
faire
together
face à cette
to
nouvelle
address the
situation
current
dans le
situation
cadre d'une
in a
approche
coordinated
coordonnée
and
et
collaborative
collaborative.
fashion.
Mes homologues provinciaux et territoriaux et moi-même
provincial and
avons
territorial
convenu de
counterparts
faire notre
have all
part
agreed to do
pour
their part
ralentir la
in order
propagation
to
du
slow
variant
down the
Omicron,
spread of
ce qui
Omicron,
signifie
which
1.
means
L'accélération de
speeding up the
l'administration des
administration of
doses de
boosters to
rappel à toute la
Canadians,
population. 2. Le renforcement des
public health
mesures de
measures,
santé publique. Et 3.
and
L'augmentation
making rapid
de
tests
l'accessibilité
more
des
broadly
tests
accessible to
rapides
the general
pour le grand
public.
public. À mes collègues ministres de
To
la
my
Santé
fellow
de
health
tous les pays,
ministers
je veux
across
dire
the
très
country,
clairement,
I want to
vous
say
pourrez
very
toujours
clearly,
compter sur le
you can
gouvernement
always
canadien
rely on the
pour
Canadian
vous soutenir.
government to
Nous
support
sommes
you.
tous là pour nous aider les uns les
We are here
autres.
to help each other.
Notre approvisionnement en vaccins
Our
est
supply
prêt
of
et
vaccines
disponible
is
et nous
ready and
sommes
available,
encouragés par
and we are
l'engagement
encouraged by the
réaffirmé
provinces
et
and
solide
territories'
des
reaffirmed
provinces et des
commitment to
territoires
speed up
à
their
accélérer
booster programs.
leur programme d'administration des doses de rappel. Les provinces et
Provinces
territoires
and
ont demandé
territories have
35
requested
millions de tests
35
rapides et
million
35
rapid
millions de
tests.
tests rapides vont être livrés
They
en
will be
décembre.
delivered in
La plupart de ces
December.
tests rapides
Most
sont
of these
déjà
rapid tests have
arrivés.
already been delivered.
Grâce aux investissements importants
Thanks to the
confirmés par ma
significant
collègue la
investments
ministre
confirmed
Freeland
by my
au
colleague, the
cours des
Deputy
derniers
Prime
jours,
Minister,
nous
Minister
allons
Freeland,
acquérir et fournir des centaines de
we will
millions de
procure
tests
and
rapides
supply hundreds of
additionnels
millions
à
of
nos
additional
partenaires
tests
provinciaux
to our
et
provincial and
territoriaux au cours des
territorial
prochains mois.
partners over the coming months.
Nous serons prêts à répondre aux besoins des
We will also
provinces
be
si
ready
et quand elles ont besoin de plus d'appui.
To
Les provinces et
provide more
territoires
support to
doivent savoir
provinces
que
and
lorsqu'elles
territories
se
should they
tourneront et
require
qu'ils se
additional
retourneront
support.
vers nous,
Provinces and
ils auront
territories
toujours
must know
une
that when
main
they turn to
tendue.
us, they will
Nous
always
sommes
find
là
a
pour nous aider
helping
les uns
hand.
les autres.
We are here
Notre
to help
objectif
each
commun
other.
est le même,
Our goal
protéger
is
la
one and
santé,
the same,
et la
to protect
sécurité
the
de
health and
tous les
safety
Canadiens
of
et
all
de toutes les
Canadians,
Canadiens, peu importe où ils ou
regardless
elles
of where
peuvent
they live.
vivre. Permettez-moi d'insister une fois de
Allow
plus.
me
Nos
once
actions
again
au
to be
cours des
very clear.
prochains jours
Our
et
actions
des
over the
prochaines
coming
semaines
weeks
seront
and months
déterminants
and
pour
days
notre sort au
will
cours des
determine
prochains mois.
our fate over
Cela est
the
vrai
coming
pour les
months.
gouvernements, mais cela est vrai aussi pour
That is
nous,
true for
citoyens.
governments and also for
À
all
toutes
of
celles et
us
tous ceux
citizens.
qui nous écoutent, je veux
all those
livrer un
listening,
message très
I
clair.
want to
Nous
provide a
devons
clear
faire tous
message.
et toutes notre part.
We must
Je
all do
sais que
our
nous avons
part.
fait énormément
I
de
know that we
sacrifices au
have
cours
made
des 21
many
derniers mois.
sacrifices over the
Je sais que nous en
25
avons tous assez
over the past
de cette
21
pandémie.
months. I know
Je sais que cette
that
situation
we
est
are all sick of
particulièrement
this
éprouvante
pandemic.
d'un point
I
de
know
vue
that this is
psychologique
extremely
et que
difficult
nous sommes toutefois un
psychologically,
peuple résilient.
but we are resilient.
Mais nous nous sommes rendus jusqu'ici et
We've
ce n'est
come
pas
this
le temps
far.
de lâcher.
Now is not the time to
Ensemble,
give
nous
up.
pouvons changer le cours
Together,
des choses au
we can
cours des
change
prochaines semaines
the course
en
of
raison
things
de nos
over the
actions
coming weeks.
individuelles. Si vous n'avez pas
Thanks to our
reçu votre
individual
première ou
decisions.
votre
If
deuxième
you haven't
dose,
gotten your first or
allez-y
second dose,
maintenant.
go now.
Si vous êtes
If you
admissible
are
à une dose de
eligible for
rappel,
your third
allez-y
dose,
maintenant.
go now.
Et s'il vous plaît,
And please,
évitez de voyager
avoid
et suivez
travel
toutes
and
les
follow
directives
all
des
provincial
provinces et
and
des
local
autorités
public health
locales en
guidelines.
matière de santé publique. Ensemble,
Together,
nous et tout cela pourra nous
We
aider
and
à
that
sauver de
can save
nombreuses
lives,
vies.
many lives.
Merci et nous serions maintenant heureux
Thank
de
you.
nous tourner vers vous pour
We
questions
would now
ou
be
commentaires.
pleased to answer your questions or comments.
All right, thanks very much, everyone. Just in case this wasn't clear, as we've been doing for the last couple of weeks, we're using a bit more of an orderly approach here to help out our interpreter colleagues. I'm going to call up everyone in the room one by one to each alternating mic to make sure we can get to as many questions as quickly here as possible. Minister and doctors, let's try and keep our answers as concise as possible, please. We're going to rotate English and French. So we will start off here, I suppose, with Christine Ajikute from CTV News at mic 1, and we'll go with Raymond Fellion de TVA at the open mic over here afterwards.
Hello, good morning. Thanks for taking my questions. My first question is for Dr. Tam. Is the Omicron variant primarily spread by aerosols?
Yes, I think it is a highly transmissible virus, that much we know. And we already know that the SARS-CoV-2 virus can be spread by a number of routes, but aerosol is definitely a main route of spread. So as we've said before, think of it like smoke in a room. Those closest to the source will inhale more, which is why masking and ventilation is very important.
Thank you. And my next question is for Minister Duclos. Once again, we are seeing a patchwork of restrictions and cases are rising fast by community transmission. In Quebec, spectators can't go to a Canadiens game, but in Toronto, 10,000 can attend a Maple Leafs game. At what point, if ever, will your government take the lead and override provincial restrictions using the Emergencies Act?
Well, thank you for the question, and let me respond in two different ways. The situation is both dramatic and critical. Dramatic because all the information that public health officials are sharing is that this is a severe issue. The way in which this variant is transmitting itself is going to most likely put a very severe load on hospitalizations in the next few weeks. It's also critical because what we do now is going to have an impact on what will happen in just a few weeks from now. So that's why I had this conversation with my colleagues on Wednesday, just a few hours ago, and we all agreed that we had to work together in order to do what they have already announced in most cases, an increase in boosters administration, an indication that public health measures not only need to be enhanced, which they have already done, and I commend them for that. And by the way, that's not easy for them to do. We are all very tired, and we would all like to think in a different manner, but the provinces and territories are acting quickly, and they're sending the right signal and putting into place the right measures. And finally, the third thing is that it's good to have enhanced public health measures. It's obviously extremely important for Canadians to follow those health measures. And one conversation I had with my G7 counterparts just yesterday morning, I had a meeting with all G7 health ministers, and one of them said that our responsibility as health ministers is a difficult responsibility of sending difficult messages. We know we don't want to hear these things, and provinces and territories don't like to say those things either. But it's important for people to realize that this is very both dramatic and critical, and we need to act now, and I commend them for having acted quickly.
Okay, our next question is from Raymond Fellion de TVA, and we'll go to Laura Osman from the Canadian Press at the open mic after that.
Bonjour, M. Duclos. J'aimerais vous entendre au sujet des voyages de moins de 72 heures, le retour des tests PCR obligatoires. Pourquoi pas une exception pour les courts voyages aux États-Unis? Parce que quand on regarde la situation, on peut aller visiter de la famille à Toronto, faire du ski à Tremblant. Pourquoi on ne pourrait pas faire la même chose juste de l'autre côté de la frontière?
Mais vous avez raison, il y a deux choses ici. Les mesures de santé publique internes, intérieures, dont sont responsables les provinces et les territoires, et il y a les mesures de santé publique qui touchent la frontière. Alors, ce que l'on veut absolument faire, c'est de décourager les gens de voyager à l'étranger, même pour de courts séjours, en raison de la transmissibilité très forte du nouveau variant. Même des séjours de quelques jours peuvent mettre en danger la santé et la sécurité des gens qui choisissent de voyager. Alors, c'est pour ça qu'on met ça en place, pour faire en sorte que que quand les gens reviennent, bien,
when
ils ne
people
reviennent
come
pas
back,
avec le variant,
don't
avec
bring the
Omicron,
variant
et qu'ils sachent
Omicron
déjà
back with
que si
them.
jamais ils choisissent
And so
de
if ever
partir,
they
ce qu'on les
decide to
décourage de
travel, which
faire,
we
bien,
discourage,
ils vont devoir arriver, revenir avec un test
they'll have to come
PCR
back with
fait
a
en dehors, peu
PCR
importe
test
où ils aillent.
done in another
Est-ce
country.
qu'avec Omicron, les règles d'isolement
With
vont
Omicron,
changer ou
will
pourraient
the
changer pour
isolation
les gens
rules
vaccinés
change? Could
qui
they
entrent en
change for
contact avec
vaccinated
quelqu'un
people who
d'infecté?
come into contact with an infected person?
Possiblement, parce que,
Answer,
et ça c'est
possibly.
une question que vous pourriez vouloir
This is a
poser
question you
aux
may
experts en
wish
santé publique, parce
to
que ce
ask the
qu'on
public health
entend,
experts,
c'est
because what we're
que, et ce qu'on
hearing
voit d'ailleurs dans les
and what
chiffres,
we're seeing in
c'est
the
que
numbers
la protection
is that
qu'offrent les vaccins
protection offered by
contre le
vaccines
nouveau variant,
against the new
contre
variant,
la transmissibilité de ce nouveau
with the
variant, cette
transmissibility
protection,
of this
elle est
new variant,
significativement
the
plus
protection
faible
is
avec le nouveau
weaker
variant
with the
qu'avec
new variant
les anciens variants. Et
than
ça
with the
explique
previous
pourquoi
variants.
partout dans le monde, on le voit,
that
on a
is
vu
why
des
around the
exemples en
world,
Norvège et ailleurs,
we've
on s'explique
seen
pourquoi
examples in
des gens
Norway and
déjà vaccinés, qui ont
elsewhere.
fait leur travail,
People who
ont
are
une plus
already
grande
vaccinated
probabilité d'attraper ce nouveau
have a higher
variant Omicron.
risk
Donc, il pourrait y
of
avoir
catching
effectivement,
Omicron.
et on va le voir au cours des prochains jours, probablement,
So we'll see this in the
dans les
coming days,
provinces et
probably
territoires, des
in the
mesures
provinces and
qui vont
territories.
s'étendre
Measures
à des gens vaccinés
extend
pour
to
lesquels
vaccinated
des anciennes
people
mesures ne s'appliquaient pas.
to whom former measures did
Laura
not apply.
Osman from the Canadian Press, and after that, we'll go to Julianne Lepoint from Radio-Canada.
Taking our questions this morning. I wanted to ask about the reinstatement of the 72-hour rule. I hear you saying that now the test will need to be taken outside of Canada. So that's a change, but public health experts rather, said before that because of the incubation period, you're still not necessarily going to catch cases coming back into Canada because it's been such a short period since they probably contracted it in the United States. So what is the justification for reinstating that rule? Is it just to make it more cumbersome to deter people from taking that trip in the first place?
Well, as all measures, this is not a perfect measure, no, but it's an important one. It's an additional layer to protect the health and safety of those that are traveling and those that would be exposed to them once these people come back to the country. So as always, there is no perfect measure, but the combination of different measures brings us closer to a close to perfect system.
I'm wondering if the doctors might be able to weigh in as well on the effectiveness of this measure in terms of actually capturing cases coming back into Canada.
Yes, of course. Dr. Tam or Dr. New?
Yes, excuse me, I actually having a bit of difficulty hearing from the room, but I believe it's about the 72-hour pre-departure or pre-arrival test. So yes, if you went to the United States and you catch COVID-19, you catch the virus, it does take a bit of time for incubation period to occur. So the test taken just before Canada won't catch everyone. We believe, based on the information that we have, the Omicron virus seems to escalate in terms of being, you catch it and then the incubation period may be a little bit shorter than for the other viruses. That is still under investigation. So that's only one layer of protection and may not catch everyone, as the minister said. But on post-arrival, we are still using a method of mandatory random testing to potentially detect others. And from the United States, people who've traveled from the United States or going through the United States.
It's Dr. New. Maybe I could just add another point. Regardless of, the testing regime or what happens, I think Canadians should be aware and really think carefully about why they're going into the United States, for any trip. I think there's a big difference in terms of the potential risk of being exposed to the virus if, let's say, you're crossing the border just quickly to pick up, some groceries or to get some cheap gas, as opposed to, planning to go across for, a tailgating party at a football game and then going bar hopping, et cetera, and so on. So I think, you need to think carefully about the kinds of activities of what you would be doing in the U.S., be it for the 72 hours or less. Thank you.
Julianne Lepoint de Radio-Canada, and after that, we'll have Abigail Beenan from Global News.
Bonjour.
Hello.
Je comprends que, bien sûr, les déplacements interprovinciaux, c'est une question pour les provinces. Par contre, j'aimerais savoir, est-ce que La possibilité de réduire les déplacements entre les régions, ça a été évoqué pendant vos discussions avec vos homologues provinciaux et j'aimerais peut-être entendre aussi les médecins là-dessus. Est-ce qu'on est rendu à discuter de la possibilité là, de demander aux Canadiens de réduire leurs déplacements à l'intérieur du pays également?
Bien, je vais laisser naturellement et correctement les docteurs répondre. Je vais juste donner une statistique que la plupart des gens vont comprendre assez facilement. Dans ma conversation justement avec les ministres du G7 hier matin, on avait des experts internationaux qui nous rappelaient, qui nous expliquaient quelles étaient là, les informations sur le nouveau variant Omicron. Puis un chiffre qui est ressorti, c'est que le R0, là, que plusieurs ont appris à comprendre au cours des 20 derniers mois, le R0, c'est le nombre de gens qu'une personne contamine. Alors, pour qu'une pandémie soit stable ou disparaisse, il faut que le R0 ne soit pas plus grand qu'un. Si le R0 est 1 ou plus petit, bien, on est en train de faire disparaître la pandémie. Mais le R0 du nouveau Omicron, là, il serait entre 3 et 5. Donc, chaque personne contaminée en contamine entre 3 et 5 autres. Et au Royaume-Uni, le meilleur chiffre qu'on a entendu, c'est 4,5. Alors ça donne une idée là, de la transmissibilité extraordinairement importante de ce nouveau Omicron. Donc, pour revenir à 1 et descendre en bas de 1, il faut essentiellement réduire de 3 à 5 fois le nombre de contacts que les gens ont présentement à travers le monde, mais au Canada en particulier. Pour ramener ce 3 à 5 vers 1, on divise par 3 ou par 5. Donc, réduire de 3 ou jusqu'à 5 fois le nombre de contacts. Et comme vous l'avez donc suggéré, les mesures de santé publique, partout à l'international comme au pays, vont devoir se tourner rapidement. On le fait déjà au Québec et ailleurs depuis les annonces récentes. Se tourner rapidement vers la réduction des contacts qu'on a avec les autres pour pouvoir protéger nos travailleurs de la santé et protéger notre système de santé au cours des prochaines semaines. Docteur New, Dr. Tam, est-ce que vous souhaitez ajouter à ce qui vient d'être dit?
C'est Dr. New. Peut-être je peux commencer en français. Oui, c'est sûr, l'enjeu des voyages interprovinciaux aussi avec les territoires, c'est un enjeu. On continue de discuter avec nos homologues des provinces et des territoires. Et on voit que le Canada est un grand pays. La situation épidémiologique, il y a vraiment une variation entre les provinces et les territoires, même dans une province. Région et d'autres. Donc, on a déjà vu pour quelques provinces, les provinces atlantiques et aussi les territoires, avec leur système de soins de santé peut-être un peu plus fragile, ils ont mis en vigueur les politiques pour protéger leur propre population. Donc, je pense que ça va continuer, même avec l'arrivée avec le variant Omicron. Et je pense c'est vraiment pour protéger leur propre population. Donc, on continue à discuter avec nos homologues, mais le principe, c'est on dit à tous les Canadiens de vraiment limiter le nombre de contacts, si c'est possible, vraiment peut-être garder seulement les contacts avec les membres de votre foyer. Ça peut appliquer aussi à des voyages, même hors de votre province. Mais on sait qu'avec les fêtes, il y a des familles, les membres peut-être un peu partout avec les jeunes, les étudiants qui peut-être font les études dans une autre province. Et c'est toujours une question de peut-être avec beaucoup de prudence prendre les mesures si on a des rassemblements à l'intérieur familial avec le porte-masque, ventilation, tout ça. Donc, je pense que le principe est déjà, comme le ministre a constaté, c'est vraiment pour diminuer le plus possible le nombre de contacts entre les personnes. Merci.
Donc, je vais rebondir là-dessus pour vous demander, la question est pour vous, Monsieur le ministre, mais également le Dr. New. Qu'est-ce que vous pensez des mesures qui ont été annoncées par le premier ministre Legault? Est-ce que l'Ontario, par exemple, devrait suivre l'exemple du Québec en ce qui a trait notamment à la réduction du nombre de personnes dans un rassemblement?
Je crois que l'annonce de M. Legault hier était difficile à faire. C'était la bonne chose à faire et je pense que beaucoup de Québécois lui sont reconnaissants. Je crois qu'on est tous conscients que pour le gouvernement du Québec, comme pour d'autres d'autres gouvernements à l'échelle du pays. C'est une situation qui est critique, comme M. Legault le disait. On n'est pas dans un concours de popularité. On a la responsabilité de dire les choses clairement pour que les gens puissent comprendre pourquoi on leur demande de faire de prendre des actions qui ne sont pas agréables pour personne. Moi-même, je n'aime pas entendre je n'aime pas voir ce que je vois et d'entendre ce que j'entends, mais c'est important de le savoir tôt, comme on l'a fait au Québec hier, pour pouvoir non seulement changer les actions, mais aussi changer les attitudes par rapport à la situation qui s'en vient.
Our next question will be from Abigail Beeman at Global News, and we'll go after that to Boris Prou from Le Devoir.
Hi there. For Minister Duclos, first, over the past few days, you, the Prime Minister, Minister Alghabra, all sort of telegraphed that there would be something more coming in terms of testing measures at the border. A lot of Canadians are, scrambling, felt caught off guard with changes to their plans so close to Christmas. I'm wondering if you can say today whether that's the last change in rules coming before Christmas next week and this holiday period. Can you give Canadians some assurances that these are the rules of the game now, or could they still change further?
Well, I can say three things. The first one is that we understand how difficult it is for people not to be asked not to travel, but we know that's the right thing to do for their own health and safety. We don't want them to be stranded or sick abroad, because if this did happen, as I said earlier, there would be very little that we can do here in the federal government to help them. The second thing, we're also mindful that this is difficult for airlines, the tourism industry, airports. This is obviously not good news for them, and they've struggled for many months now. The third thing I can say is that things will continue to change unless the situation doesn't change and new information doesn't arrive. Things will keep being adjusted. I believe Canadians have seen how quickly the evolution can change around Omicron, and I think Canadians have understood that Canadians and governments have the responsibility to adapt to those changes when they do occur.
My second question is for the doctors. Yesterday, the Ontario Science Table sort of poured cold water on the idea that Omicron may be more mild. And I know that last week at the update, you specifically said that all the cases of Omicron in Canada were either mild or asymptomatic. So I'm just wondering if there's any change to that fact this week, and what you think and what information we have in Canada in general about whether Omicron may be less virulent.
Yes, I can start. So we know that not all cases are necessarily detected or reported at this time, so they're still escalating. And with over 300 cases, of the information we received, they're all either mild or asymptomatic. But there's a range of mild, and some people are essentially short of breath or they're not hospitalized. Most of these are younger people. So we have not seen Omicron spread into the high-risk group at this point, and we hope it would not, given the measures that should be put in place and the boosters for our most high risk. So at this point, we have not detected that. I think the most important key message is that even if this virus is relatively mild, especially compared to Delta, for example, it is so transmissible that even a small rate of severe outcomes could result in a high enough hospitalization rate that it can overwhelm the system. I do think that really good news is the whole world is working on this question, and we will essentially, I think, get more information, even as the days are coming along from the United Kingdom and elsewhere. But we have seen the full spectrum of illness from Omicron, including hospitalizations in the UK, for instance. So we mustn't dismiss this virus lightly.
Okay, our next question is Boris Prou from Le Devoir. We'll go to Tom Perry from CBC after that.
Merci. Monsieur Duclos, hier, le premier ministre du Québec, François Legault, a évoqué de l'aide fédérale qui serait disponible pour les entreprises et les individus à la lumière de ce qui a été annoncé hier. Je voulais savoir si ce qui a été annoncé entre dans la définition d'un confinement pour l'aide aux individus, la nouvelle aide incluse dans ces deux, c'est-à-dire la nouvelle PCU pour confinement.
Bien, merci. Laissez-moi brièvement revenir à l'annonce d'hier. Monsieur Legault, Monsieur Dubé, avec qui je parle très régulièrement, ont bien capté le cadre de l'urgence à laquelle on fait face. Il y a, et j'en entendais parler à nouveau là, avec les ministres de la Santé du G7 hier matin, il y a partout dans le monde, y compris au Québec et ailleurs au Canada, une tempête parfaite qui pourrait se produire au cours des prochaines semaines, c'est-à-dire des cas d'infection beaucoup plus nombreux à travers le pays et donc des gens en demande et en besoin de services de soins de santé en beaucoup plus grand nombre, y compris dans les hôpitaux. Et en parallèle avec ça, des infections des travailleurs de la santé qui pourraient se développer rapidement. Alors, moins de gens capables de prendre soin de plus de gens. C'est une tempête parfaite qu'il faut absolument éviter. Les pays du G7 en sont conscients et avec l'annonce d'hier au Québec et avec les mesures de santé publique annoncées un peu partout à travers le pays dans les derniers jours, je pense qu'on est davantage capable de l'éviter, cette tempête parfaite. Une coïncidence importante et très utile à laquelle vous faites allusion, c'est le passage du projet de loi C2. Et il y a effectivement dans ce projet de loi C2 des dispositions exactement prévues pour des cas tout encore hypothétiques, mais qui pourraient devenir réels, où les entreprises et les travailleurs vont devoir être confinés, fermés, et donc des circonstances par lesquelles le gouvernement canadien va pouvoir être rapidement capable de les aider financièrement.
Ça ne répond pas du tout à ma question. C'est pas hypothétique. Ce qui a été annoncé hier, c'était des mesures. Ce n'est juste pas clair. Ça entre dans la définition d'un confinement pour pouvoir entrer dans la définition de... Est-ce que finalement les Québécois, la semaine prochaine, dans 2 semaines, vont pouvoir utiliser cette nouvelle prestation?
Désolé si je n'ai pas été assez clair, mais la réponse peut-être plus claire, c'est que oui, ce projet de loi est un projet de loi et donc des mesures maintenant disponibles dans des cas de confinement. On n'est pas encore là. On espère ne pas y arriver. Mais si jamais on y arrivait, c'est la définition d'un confinement. Hier, ce n'est pas un confinement, on n'a pas fermé qui que ce soit ou quoi que ce soit. On espère ne pas arriver là. Mais si on arrivait là, le projet de loi C2 serait là pour aider à la fois les entreprises et les travailleurs.
Tom Perry from CBC and Tonda McCharles from the Toronto Star, I believe, can go up to the other mic afterwards. I believe we're running a little tight on the minister, so hopefully we can just squeeze in as much as we can before he has to head off here. We do have the doctors until 12:30.
Thanks for taking my questions. Minister, can I ask you, it's a bit of a multi-part question, but presumably these measures you're bringing in are going to mean fewer people traveling. So when are you going to have the capacity to test everybody arriving by air in Canada? Do you anticipate having to expand that to people coming in even from the United States by air? And I guess overall, like what impact, given that Omicron's already here, what impact is any of this going to have on the spread of the virus in Canada?
Okay, many questions, many important questions. Let me try not to forget any of them. So first on air, as I've indicated earlier, we moved from 11,000 to 17,000 last week to 21,000 as of today, and the goal is 23,000. So we're close to the end goal. Second on U.S. the land border with the United States, we're also preparing to increase significantly the capacity around the land border with the United States. The situation in the U.S. is currently different from what we see outside of North America. Per capita, the U.S. officially has about 10 times fewer Omicron cases than in Canada. Denmark has per capita 200 times or 100 times more Omicron cases than in Canada. So the ratios are very different. But we know that it will come also in the United States. That's why we're preparing to, and we're doing that right now, to increase capacity of tests at the land border. Now, on community transmission versus importation of Omicron cases, that's a fair statement. Now, we've known for the last 21 months that it's community transmission that matters the most. perhaps not initially, as in the case of the last few weeks, but it's becoming evident now that the vast majority of Omicron cases are due to community transmission. And that's why our collaborative work with provinces and territories and the important steps that provinces and territories are taking and will continue to take, I'm quite certain, that's why this is so important.
And I had a question for the doctors, for Dr. Tam or Dr. New. With all this talk of boosters, I'm wondering, for people who have had, say, a dose, their first dose of AstraZeneca, a second dose of Pfizer, and now going for, or Pfizer or Moderna, and going for a third dose, a booster shot now of an mRNA vaccine, are they going to require a fourth dose, given that AstraZeneca seems to be less effective against Omicron? So are they kind of in line for should they expect to have to get a second booster, a fourth dose to get full protection?
Thank you for the question. And we're, of course, learning about vaccines all the time. And at this point, I think if you've already had a dose and you've had 2 doses, the recommendation right now, for most people, not for the immunocompromised, but for most people, then you just, right now, just get your mRNA booster. Either one is great, Pfizer or Moderna. Moderna is an excellent choice. It is offered in 2 different dosage, depending on your age and underlying risk factors. But I think either of those vaccines will be great for 1 additional dose. Of course, we'll continue to learn and provide updated recommendations going into the future. And then people who've had other vaccines are not authorized in Canada. We had previously already recommended an additional dose for those individuals as well.
Todd McCharles from the Toronto Star, and then we'll go to the phone lines after that.
Good morning, Minister. Could you speak a little bit more about the numbers that you're looking at? So the U.S., they have about 60% vaccination coverage with a second dose, but only 16 with boosters. So can you talk about what your thinking is around why you're not putting tougher restrictions on people coming in from the U.S. to Canada? That's the more likely crossing for a lot of places in Canada. So why are you not as concerned about U.S. crossers?
Well, for 2 reasons, as I've said earlier. The first one is that per capita, they currently have 10 times fewer Omicron cases than we do in Canada. But we know that is most likely.
That's accurate reporting of their situation?
Well, even in Canada, we don't have accurate information, and it's likely that in the U.S. that information is both inaccurate and outdated. So it's certainly the case. So we're working with the numbers that we've got. And then the second thing is that, as I mentioned just a moment ago, in Denmark, they have 100 times more cases of Omicron per capita than we have in Canada. And that's true for many other countries in Europe in particular. No, it's there now. So that's why we're focusing, and we've both been focusing our testing efforts on air arrivals from those places as we prepare, and the time will come when we will also enhance our testing efforts around the land border with the United States. But let's also remember that we have multiple layers of protection in Canada, which is something that we see in almost no other places on Earth. I was talking to my G7 health ministers yesterday, and in the conversation, some of them were talking about having a pre-arrival test. We have had a pre-arrival test in Canada for many, many months. So that's already a very strict and very strong layer of protection, to which we're adding other layers of protection because that's what we believe needs to be done.
And so I'm not sure if that 23,000 number and whatever number you're aiming at the land border will cover everyone coming in from the U.S. If you have a number on that, I'd appreciate it. But I'm wondering by what date you expect there to be enough vaccine supply in Canada to ensure that all eligible Canadians have access to a booster dose. What's your date?
Okay, I can give you numbers, and then we can figure out the dates. So as of today, about 3.5 million Canadians have received a third dose, a booster dose. We have in stock 22 million booster doses. That's in addition to the 2.9 pediatric doses that will be delivered in January. So let's remember that there is a pediatric vaccination exercise, 2.9 million doses delivered in November and December, another 2.9 coming in January. Those are for children ages 5 to 11. 3.5 million older Canadians have received a booster dose as of now. We have 22 million additional booster doses available. So 22 plus 3.5, that gives 25.5. So we're not far from the 30 million doses that we would need to give every Canadian a booster dose.
By what date? All eligible Canadians. So that will include pediatric doses. So is it January or February or March?
Minister, I'm going to ask you to answer the question there. I'm going to have to cut it off and go to the phones. Yep. Okay, so we're going to, was there a final answer that you wanted to add there, Minister? Or?
Well, we wouldn't need to ask Minister Tassi because she's the one who knows exactly those numbers. I know that by memory, in the next quarter, in Q1 2022, I think we have ordered 20 million doses. So if you add 3.5 plus 22 in stock plus another 20 million, I think most people will understand that the priority now is to get those doses into the arms of people. No, there should be no anxiety as to where or how those doses will come from. We have them now, and if we need a couple of million more, they'll come in the next few weeks. What the priority now is, and it's a challenge for provinces and territories, but doing a very good job. All of them have announced in the last hours or days that they are significantly increasing their booster administration activities. That's great news because we have lots of doses. Now we need Canadians to get those doses.
The phones now. I believe the new hard out is 12:15 for both the minister and the doctors. Operator, if we can squeeze in questions during that time, one question, one follow, and if it's possible, please prioritize members of the Parliamentary Press Gallery.
Thank you. Please press star one at this time if you have a question. The first question is from Mary Kay Walsh to Globe and Mail. À vous la parole. Please go ahead.
Good afternoon. Thanks so much for taking my question. This is, I think, for Minister Duclos as well as for Dr. Tam. Can you please explain the scientific rationale why it is more valuable to test 23,000 people coming into Canada who already have a pre-entry test compared just with randomly testing 23,000 people on the streets in Canada?
Well, this is a great question, but the answer depends, of course, on who you ask the question to. If you ask the federal government where we can invest our testing resources, it's around the border. That's what we have the ability to operate on. And as you have noticed, we are investing those resources in the priority areas where those resources need to be invested. Now, when it comes to testing Canadians across Canada, wherever they may live, that's obviously the domain of responsibility and effectiveness of provinces and territories. And I would say that they are doing a good job. No, it's going to be a job that it will be increasingly difficult and challenging over the next days and weeks as more people get infected. There will be an increased demand on PCR testing across Canada, but they are prepared to meet that demand. We have invested significant resources in collaboration with them over the last 21 months. They have a large capacity to test people, and they will need to use a significant portion of that capacity over the next days and weeks.
Yes, Theresa Tam. Yeah, so I think as we can all appreciate, testing catches people who are positive in a moment in time. So I think the policy has been to test travelers more than once during their travel journey. I think the testing regime on arrival has served as well in that we've been able to use it to not only test all people who are unvaccinated, but also to use a robust sampling approach to detect any positivity in vaccinated individuals as well. And through that program, we've been able to pick up positives from different countries, as an ongoing monitoring system. So if there's a signal, we can potentially do something about it. For example, we did that signal detection for Morocco, for India, and other countries. So it's there to inform us on potential additional border measures. But very importantly, we are able to use that sample to sequence. So the pre-arrival test, we can't ask for those samples, obviously. So I think having the PCR and molecular testing sample allows us to give us a better idea of the variants that might be coming into Canada.
Is there a follow-up on the phone?
Thank you. And as my follow-up, as my follow-up for Mr. Duclos, can you please confirm what is happening with a third country testing requirement? For example, the travel ban on India was lifted, but there's still a requirement from the government that people only go to one testing clinic in all of India to get their pre-departure test. What is going to be the rule for these 10 countries in Africa? Will all requirements be lifted, or will some sort of strange special needs on testing still be in place, and what are they?
Well, thank you. I will provide an answer and then ask for another answer to be provided to you. So on the 10-country rule, which I described earlier, so that rule is going to disappear in the next days, and that what it therefore means is that people having traveled through those 10 countries will be subjected to the same rules as those traveling from other countries into Canada. When it comes to the where the pre-arrival test needs to be taken, I will ask my team to follow up with you because it's a responsibility of my colleague, Minister Algabra. I just would like that question to be as precisely answered as precisely answered as possible by my colleague, Minister Algabra.
Unfortunately, I believe that's all the time that we have for the minister and the doctors today. It is 12:15, so we're going to have to let them go. Minister Duclos, thank you for joining us. Doctors, thank you for your time as well.
Merci tout le monde.
Thank you, everyone.
Then it will depend, we can't give you a date because all of it will depend on how fast can provinces build back that administration capacity.
I get that.
But supply is really,
supply is a question.
But by now, we have more than enough supply for the next 4 months at the current rate. If the provinces speed it up, which they are, it's not going to be 4 months long, but we have additional supply coming in next month, right? So supply is really not an issue. The main issue is an HR issue. That's why provinces are calling on Canadians to help them. They need people.
People, all eligible people could be.
Well, that's what right now, if you use the 22 million doses you have and respect nasty delay, do it right now. By the time, people 18 years old or more can access their shots, and some provinces are saying 3 months. Like we have more than we need right now.
But here's what I'm asking. You guys must have aimed at a whole bunch of factors, right? So in an ideal world, because you would have, say, enough supply and a mass vaccination program underway for the booster, is the answer, in an ideal world, you could have everyone who's eligible